Look closely at this African buffalo. A tiny bird is perched on its face, and it pecks directly at the highly sensitive skin bordering the animal's eye and inner ear. Out in the wild, any creature tearing at your flesh triggers a violent reaction. The universal response to this physical intrusion is to crush the threat immediately or run away. Yet these massive mammals do neither. They stand motionless. They tolerate a sharp beak stabbing at their blood and skin, as if nothing is happening. Which raises a strange question. There has to be a specific biological contract at play here, a mutual agreement strong enough to completely override a wild animal's hardwired fight-or-flight survival instinct. This total passivity indicates that the bird is not an attacker at all. It operates as an indispensable asset for the host animal's long-term survival. The oxpecker is the savanna's designated general practitioner. The baseline level of their biological business deal is straightforward. The bird lands on the broad, flat expanses of the host's hide, continually scanning the surface to hunt down and consume ticks, fleas, and common insects. But the work quickly moves beyond surface-level grooming. The oxpecker routinely navigates high-risk anatomical territory, extending its sharp beak deep inside the host's nasal cavity to extract pests from the mucosal lining. Moving to the auditory system, the oxpecker's beak reaches completely past the outer ear, extracting deep parasites. Both profit immensely. The bird secures continuous calories, while the host gets thorough removal of disease vectors, returning sensitive tissue to a clean baseline. This daily invasive grooming routine operates as a high-efficiency healthcare system that maintains the host's physical peak and keeps their immune system from being overwhelmed. However, preventative care is only one part of the job. Out on the savanna, severe physical trauma is an everyday reality. When a host suffers a deep, open injury from a predator attack or territorial dispute, the oxpecker begins performing active trauma surgery. The reality of this procedure is aggressively graphic. The bird lands directly on the open injury and intentionally targets the rotting, necrotic flesh bordering the wound, eating the dead tissue piece by piece. It also actively hunts for secondary threats. The bird plunges into the wet laceration to pull out and consume dangerous fly larvae and maggots festering inside the open cavity. This is surgical debridement, the mechanical removal of infected tissue, necessary to prevent a minor injury from becoming a fatal infection. The immediate physiological aftermath of this extreme wound cleaning is a completely exposed, highly sterile tissue bed. This progression chart shows exactly how that guarantees survival. On the left side, we see an untreated wound where dead tissue acts as a bridge, allowing bacterial infection to rapidly multiply and spread outward. On the right, we see the bird physically removing that dead tissue, creating a hard boundary that stops the bacteria from migrating into healthy cells. Without that physical intervention, the untreated side is completely overrun, leading to systemic infection and a slow death for the host. On the clean side, healthy tissue rapidly expands to seal the gap. For doing this dirty, dangerous work, the oxpecker receives an incredibly dense nutritional payout. The blood, tissue, and engorged parasites provide a concentrated caloric bomb that is difficult to secure anywhere else. Every calorie consumed by the bird translates directly into days of extended life for the mammal. Both parties extract exactly what they need to endure their harsh environment. The evolutionary contract between these two species requires the host to allow a bird to feast on its open wounds to ensure they both survive the season.